Hi everybody, it's Dr. Osgood here with GrassRoots Functional Medicine. Today I wanted to talk to you about a topic that I am very passionate about. I see a lot of children affected by these disorders in the clinic, and unfortunately they're going for months, if not years on end, getting misdiagnosis, pushed down the psychiatric pathway when there's legitimate causes for their complaints and for their symptoms. And these two conditions are PANS and PANDAS. For those of you who are not familiar with PANS, PANS is Pediatric Acute Onset Neuropsychiatric Syndrome, and PANDAS is Pediatric Autoimmune Neuropsychiatric Disorders associated with strep. So before we jump into the nitty-gritty of these two conditions, it's really important for you to understand autoimmunity because both of these conditions have an autoimmune component. Autoimmunity is the process of your immune system, which is supposed to protect you against harmful pathogens, flicking a switch for one reason or another, which we'll talk about a little bit later, and deciding that normal healthy tissue or normal healthy human cells are problematic. So what we're seeing is an immune response against normal tissues which should not be happening, which leads to inflammation and dysfunction. Now this attack can happen in your joints, which is typically what happens with rheumatoid arthritis. It can happen in your skeletal muscle. It can happen in your bowel, which is inflammatory bowel diseases like Crohn's or ulcerative colitis. It can happen in your brain or in your spinal cord like MS. And the autoimmune reaction in the brain is what we're seeing with PANS and PANDAS we're going to talk in more depth about. So as you can see with this slide, there are over 100 different types of autoimmune disorders that have been identified. And unfortunately, this number is continuing to grow. It's happening in almost every part of the body. Every organ system in the body is being affected by autoimmune conditions. And I think we're going to continue to see links between more other chronic diseases and autoimmunity in the near future. It's already being recognized as a contributor to cardiovascular disease. So the problem with our current model is that the medical industry is trying to focus in on pharmaceuticals that will actually shut down the immune system or specific pathways in the immune system. So not only does that lead to other problems long term, but it's not addressing why the autoimmune condition is there in the first place. And we know that autoimmunity is partly genetic, but it's a bigger part of it is environmental and related to the digestive health and stress and a whole host of other things, which I'll mention here in a little bit. But we have to be focusing in on and changing lifestyles so we address those causative agents. That's how we're going to get out of this mess. That's where we're going to see significant reductions in autoimmune disease. If this continues at this pace, our country's going to go bankrupt. For example, Humira is now the #1 selling drug, around the world, and it's costing people $38,000 a year. And that's one of those biologic agents that just works on shutting down specific aspects of the immune system. Here you can see the rate of autoimmunity and again, what it's done over the last 50 to 60 years. And you can see it's just been astronomical how much it's increased. So again, we have to think about why is this happening? There is a reason. This isn't all of a sudden just the flick of a switch, by chance now everybody's got autoimmune disorders. The environment is affecting the rates of autoimmunity, and we need to be investigating what aspects of the environment are doing this. And I think it's going to be multifactorial. So when we talk about PANS and PANDAS, they're really two conditions that are under a larger umbrella known as autoimmune neuropsychiatric disorders. And that also includes autoimmune encephalitis, which can absolutely be a problem, but not what we're going to emphasize today in the talk. When we're looking at PANS and PANDAS and autoimmune encephalitis for that matter, what we know is that the autoimmune reaction or the autoimmune response is actually happening in the basal ganglia. So what's happening is we're seeing an encephalitis in the basal ganglia, which is just a simple way of saying, or a fancy way of saying, the basal ganglia is actually inflamed. So the basal ganglia are structures in the brain that are associated with a variety of functions, including control of voluntary motor movements, procedural learning, habit learning, eye movements, cognition, emotion. And this is what we're going to be seeing from a symptom standpoint, a lot of these kids who are being affected by PANS and PANDAS. So again, PANS and PANDAS, what's really unique about these two conditions is generally they're characterized by rapid onset that coincides with a specific illness, an autoimmune condition, or just general inflammation. So one of the differentiating factors for PANS and PANDAS is the fact that, a kid was absolutely normal, they're behaving fine, just normal upbringing, everything was like it was supposed to be, and then boom, flick of the switch, now we're seeing sudden changes. And that can be after a tick bite, it can be after another infection that they caught, whether that's strep or mycoplasma, it could be after an exposure to mold or another toxin. Something sets the immune system off to be dysfunctional, and we're seeing a sudden reaction that manifests in a variety of different ways. So I mentioned it before, but PANS and PANDAS are, these conditions are misdiagnosed all the time, and kids are put on these hardcore drugs as it gets blamed on different psychiatric illnesses like OCD, bipolar, anxiety, schizophrenia. And these psychotropics, again, are not doing anything to address the underlying cause. It's just masking the symptoms, and most of the time, it doesn't work. The underlying cause is the autoimmune condition, and that's what needs to be addressed. So the evolution of PANS and PANDAS, it really has not been around that long, but I mean, we're going on over 20 years here where it's been in the literature. So it's time for people to get on board and recognize how much of a problem this really is. So where we first started seeing evidence of this was in the 1990s. The National Institute of Mental Health Research Unit was doing some research on Settingham's chorea and OCD, Dr. Sweeto, Leonard, and Report, and they started noticing that this was more than these children were suffering from something different than these specific conditions. So the first peer review studies came out in the mid-90s, and then continued research went on from there. And in 2012, PANS and PANDAS were actually defined as separate entities. 2015 is when we found when the diagnosis and evaluation guidelines were released, and then actual treatment guidelines were released in the Journal of Child and Adolescent Psychopharmacology in 2017. So again, we're just although this has been in the literature for quite some time now, we're really at the beginning. So there's a lot we need to learn, but there's still a lot that we can do, and it can be pretty life-changing for some of these kids. When we're looking at the symptoms of PANS, these are some of those classic symptoms, PANS and PANDAS. OCD, severe food restriction, anxiety, specifically stress, separation anxiety is big. Emotional lability, depression, irritability, aggression, severe obsessional behaviors. Developmental regression is a big one. And then, problems at school where they were doing well, now all of a sudden they've taken several steps back. Motor and sensory abnormalities are a big one, specifically tics, hallucinations, and hyperactivity, and then sleep problems. We see that a lot in kiddos. And then the problems with bladder function or enuresis. So these are just a few of the things that you may want to pay attention to and look out for. Oftentimes you'll get a number of different symptoms that are occurring together. But the big thing is to notice is to understand that the child was in a good place, and then they started to backtrack, developmentally, behaviorally, in all sorts of different ways. And then it talks a little bit about the triggers here, but we're going to go into that in more detail on the next slide. So here's a good example of behavioral regression. So this is on the left-hand side here. You can see a child's drawing during a flare, and then what was happening during treatment. And this is not a significant amount of time in between. On the right-hand side, another example when it goes looking at handwriting specifically. So some pretty significant changes there when the child is inflamed and in a flare compared to when their inflammation is down and they are being treated. Classroom manifestations. So a lot of times kids have problems that pop up during school. Kids are in school quite often, or a good portion of the year. So teachers are picking up on a lot of these things, and they can get blamed on ADHD or anxiety or depression or a whole host of different things. So some of the things you may look out for is the dramatic changes in behavior where, again, it's not the same kid that they knew before. There was a change. Performance, whether that's with math or writing, change in eating habits, alertness, bathroom habits, because of those problems with urinary frequency or wetting their pants, you're going to see them go to the bathroom a lot more often. Rage, emotional labile emotions, and then oppositional behavior. That's a big one. We see this, this set of symptoms as a big problem, and usually the rage specifically is one that sets parents off to know that something is wrong, something is not right. But these are also the symptoms that get psychologists and psychiatrists and other neurologists to get on board with prescribing psychotropics. But these are big hints that something is going on in that brain and something's contributing to that. So difficulty interacting with the peers, and then obviously physical complaints. And there can be a whole host of different physical complaints, whether that's gut issues, whether that's joint pain or headaches, and then separation anxiety and phobias for school. I've got a lot of kiddos that really, when they're flaring, will not go to school. They just want to be homebodies. So when we start to look at what physical manifestations are seen with PANS and PANDAS, of course, each child is going to present differently, but one of the things that you may see is coliform movements. And for those of you who aren't familiar with coliform movements, what they are is they're small, jerky, arrhythmic, irregular movements that the child may present with. One of the best ways to test for this is one of the things that I recommend and do in the clinic, is to actually have your child close their eyes and put their hands out straight. And what you're going to see, we call this the piano playing test, is they may start to look like they're actually playing the piano, where their fingers are doing these irregular, arrhythmic movements, and sometimes their whole body will get a little bit jerky. So that's one of the quick tests that you can do to look for these coliform movements. Other physical symptoms that you may see are margin drift. Specifically, when the child is writing, you'll see the margins start to drift. Short attention span, again, getting in the diagnosis of attention deficit disorder. Memory issues, loss of math and visual spatial skills, problems with the writing, and then executive function deficiencies. So executive function are the functions that help you manage life tasks. And this can be, all sorts of different things. But for example, executive functions let you organize trips, research a project, or a paper for school. So when they start to lose the ability to really concentrate and focus and do those executive tasks, that can be a sign of encephalitis and inflammation. So as far as looking at PANS and PANDAS, one of the most important things is to know what is triggering it, what's setting it off. And as you can see by this list, it can be a whole host of things. It can be strep, which is typically the causative agent with PANDAS. But when we're looking at PANS, it can also be a lot of other co-infections, tick-borne illness, viruses. So some of the more common ones we see in the practice are Mycoplasma, Bartonella. Obviously, Lyme disease is a big one here in New England. But influenza and some of these viral issues can also cause all sorts of flares and triggers. So you got to be paying attention to these things. You got to be monitoring them. And when you're in the investigative phase to try to figure out if this is the problem, these are some of those things that you want to really look at. But there can also be non-infectious sources. This could be metabolic issues, hormonal changes. So puberty can be a time where we start to see things get affected, whether that's a good thing or a bad thing. It depends on the situation and on the child. Environmental exposures to metals or molds, and then psychological stressors. This is a big one as well. So when kids are not wanting to go to school, You have to really be thinking about the big picture. Is this a psychological stressor that's setting them off? Is there an environmental allergen in the school, like mold, for example, that could be setting them off? Or is it exposure to a lot of the bugs that kids pick up at school? So a lot of variables there. You got to think outside the box and really get to the root of what's going on and what's triggering the problem to begin with. So when we're looking at diagnostic criteria, it's important to remember that there is no test out there that is going to diagnose PANS or PANDAS. This is a clinical diagnosis, much like that of Lyme disease. But when we're looking at PANDAS here, it's important to really understand this criteria to help you understand if this is what your child is going through or could be part of the equation. So the presence of clinically significant obsessions, compulsions, and or tics, unusually abrupt onset of symptoms or relapsing, remitting course of symptom severity, pre-pubertal onset symptoms of the disorder first become evident between 3 years of age and puberty, an association with streptococcal infection. In PANDAS, that's what sets it apart, is we're seeing the strep. You have to check for strep in a variety of places, which I'll mention here in a minute, but they don't always complain of your typical symptoms, like the typical sore throat or lymphadenopathy. And then association with other neuropsychiatric symptoms. So this is the criteria, one of the sets of criteria for PANDAS specifically. When we're looking at PANS, it's a little bit different. An abrupt, acute, dramatic onset of obsessive compulsive disorder or severe restricted food intake, very, very common. And then concurrent presence of additional neuropsychiatric symptoms with similarly severe and acute onset from at least 2 of the following categories. So it could be anxiety, labile emotions or depressions, irritability, aggression, oppositional behaviors, behavioral regression, sudden deterioration in school performance, motor or sensory abnormalities, somatic signs and symptoms including sleep disturbances or urinary issues. And symptoms are not better explained by a known neurological or medical disorder. So again, you don't want to get tunnel vision into thinking everything is PANS and everything is PANDAS. And that's one thing that I have found in practice, is that there's a lot of clinicians out there that specialize in certain things, and that is what they see because that is what they're passionate about. But you always want to keep a open mind, and you want to be thinking about differential diagnoses to make sure you're not missing something else that's going on that will lead to an improvement in results faster. So here are some of those differential diagnoses. Sydenham chorea, this is where a lot of the research, or this is where PANS and PANDAS actually came from, is researching Sydenham chorea, vasculitis, child abuse, toxins, medications, drugs, tumor, strokes, Tourette's, OCD, and then post-infectious neuroinflammation. These are just a few of the things you need to be thinking about to make sure that these things aren't going on as opposed to PANS. So when we're looking at screening for PANS and PANDAS, this is the form from the Institute of Functional Medicine that I have my parents fill out. And a lot of times you just know by listening to a story and listening to the symptoms, that these are things that are going on. But it's good to have this on paper just so everybody's on the same page. You can see the correlation here. So talked about a lot of these things already when we're looking at diagnostic criteria, but this is just a good resource to pay attention to help you understand whether or not this is something you need to look into further. And again, with diagnosis, it mainly is based on symptoms and based on the story, but there are some key tests that can be very helpful to help you understand if this is an autoimmune encephalitis or not. This is the Cunningham panel from Molecular Labs. This is one of the top-notch tests to see if there is an autoimmune response going on in the brain to aid with diagnosis. It's a pricey test, but I think it is worth it. And there's another test that recently came out from Vibrant Labs called the Neural Zoomer, and that has some other markers on it to help you understand if there's an autoimmune encephalitis component going on, and the test is a little bit more affordable. But this is kind of the gold standard right now. It's a great test and very helpful when making a diagnosis. Additional tests to consider, so one of the big things with strep is it's not always in the throat. So I've picked up strep in the gut. I've picked up strep, anally, doing swabs. You also want to swab the family members to make sure that they're not passing it around. So make sure when you're swabbing for strep, you're looking in multiple places. Other things to look at, immunoglobulins to see if their immune system is suppressed. Talked about the Cunningham profile, but you also want to look at other profiles looking for different viral issues or bacterial pathogens. ANA is positive in about 60% of kids with PANS and PANDAS, so that's another great test. That's a general autoimmune screen. And some of these autoimmune markers will be positive well before people are actually symptomatic. So this is a common thing that I do, a standard lab test that I do on almost all my patients when they come into the clinic. And then, ASO and DNase antibodies, again, for the strep. And then I love to really dive deep and figure out what's going on in their system using organic acid testing, stool testing. And then if we need to, we can do mycotoxin testing to see if mold is an issue in their home or in their school or in their environment. And then metals testing is another thing that can be helpful, because if their child is filled with toxins or filled with metal, or they're not detoxifying appropriately, it's not going to be very conducive to healing. And no matter what we throw at them for specific infections, if they're not mobilizing their toxins, then they're going to take a lot longer to heal. When we're looking at the treatment options for PANS and PANDAS, they actually have, in 2017, I mentioned before, they released some guidelines, and they really stem around three different components. The first being antimicrobial therapy. So when you're dealing with strep, or you're dealing with mycoplasma, or you're dealing with Lyme, or some of these other bacterial infections, antimicrobial therapy can be really, really effective. And that could come in the form of antibiotics, or it can come in the form of natural herbal therapies, antimicrobial herbs. And I use both of them in the practice. It depends on the situation. It depends on the onset. It depends on what people are comfortable with. But whenever you go down this antimicrobial pathway, no matter which way you go, you got to make sure you're protecting the gut. You're doing appropriate amount of prebiotics and probiotics and mucosal healing agents, just to make sure we're protecting the gut, because a lot of times these kids are already starting out with a lot of dysbiosis and low flora, which is contributing to the problem in the first place. Psychotropic drugs, or antidepressant therapy like SSRIs, for example, can be helpful. And sometimes they're needed in the short term. It's not something we want to do long term, but it can be helpful in the short term. And then immune modulation. There's a lot of different thought processes on this. IVIG therapy can be helpful. It's expensive. It's not helpful in all cases. You want to have some good information to guide you in that direction. But you can also, sometimes steroid burst therapies can be a useful tool to figure out if IVIG may be a step in the right direction. And then, of course, anti-inflammatories, conventional anti-inflammatories like NSAIDs, but also natural anti-inflammatories, whether that's turmeric or boswellia, and acetylcysteine can be helpful. And one of the pharmaceuticals that I use a lot in practice that seems to really work well is low-dose naltrexone, and that's a very safe and potentially effective therapy, where it's either going to work or it's not, but there's not a lot of downside to it. So this is the conventional treatment options for PANS and PANDAS. Again, very important to consider and can be very helpful. But then we have the functional medicine approach. And personally, I believe that this is absolutely essential. So if you just hit these kids with drugs, if you just hit them with antibiotics or antipsychotics or antidepressant drugs, I think it can help with the symptoms, but again, you're not really addressing the root of what's going on. So when we think about PANS and PANDAS, again, we got to get back to that whole autoimmune thought process. And we know that with autoimmunity, again, there's kind of a triad there. You've got genetic predisposition, you've got intestinal permeability issues, and you've got specific triggers, which can be toxins, molds, dietary triggers, bacteria, parasites, viruses, stress in general. All of these things will cause the immune system to be dysfunctional and which leads to that cascade of autoimmune reactions. So we can't change genetics. That's not going to happen at this time and place, but we can affect the gut and we can affect the triggers. So I put a lot of emphasis in all of my PANS and PANDAS kids on healing the gut. I think that goes a long ways. That means cleaning up the diet and figuring out what foods are going to be inflammatory and what foods are going to fuel the child's immune system. Working on gut healing protocols. We're looking at removing any type of toxic exposures, whether that's dyes or, fragrances or chemicals in their cleaning products. Really want to clean up as much of that environment as we can and optimize detoxification. All of these kids seem to have big problems with detox, which makes sense. If everybody's getting exposed to all of these different bugs, but for some reason, this subset of the population does not tolerate that burden, and then it sets them up for failure and for inflammation and immune issues. So if they're not removing these exposures fast enough, they're going to build up and cause lots of problems. So we have to open up the pipes. We got to make sure they're pooping. We got to make sure they're having frequent urination. We got to make sure they're having appropriate lymph drainage. We're supporting the microbiome. We're supporting the liver. We have to, again, think about those foundational elements, because that's what's going to take your specific therapies to the next level and lead to lasting results. And that's one of the things I make an absolute priority when I'm working with these kids. The whole concept that we're looking for when we're treating with functional medicine approach, I like to give the example of a bathtub that's overflowing. So I tell people, I say, so when we look at the immune system, everybody's got their own immune system. And we want to think of the immune system as a bathtub, where the size of the bathtub is dependent on your genetics. So if you've got good genetics, you got a big bathtub. If you've got bad genetics, your bathtub is going to be small. All of the negative exposures, from our environment are going to cause the bathtub to fill up, whereas positive influences will allow the bathtub to drain. So when we're looking at, exposures to heavy metals or toxins from our food or allergens, infections, whether that's viruses or bacteria or parasites, stressors, anything that is negative is going to cause this bathtub to overflow, to fill up and overflow. And whereas exercise, detox, good nutrition, meditation, prayer, deep breathing, healthy gut, healthy flora, all of these things are going to help drain out the bathtub. But unfortunately, you get to this point where the kids have these smaller bathtubs, they get exposed to something, the bathtub overflows, and then they get really sick. So my job as a functional medicine practitioner is to empty out this bathtub. If we don't empty out this bathtub, then you're not going to see lasting results. And that's what we're looking for. We're not just trying to treat this thing in the next couple of weeks. We're trying to get results that are sustained. So at GrassRoots, we utilize a very specific framework to help people get back to the state of optimal health they once knew. Many patients come to us after failed programs, years of struggle, and confusion about what path they need to take to regain their health. They show up with symptoms. Many of times, these symptoms are chronic and reoccurring, which leaves people so frustrated and just in desperate need of guidance. What we've found is that when practitioners fail to look at the big picture and stick to just these band-aid solutions, people rarely make the progress that they're looking for. But when we take a step back and we evaluate the big picture and we pinpoint the specific reasons that lead to imbalance and maladaptation, we find the fastest path back to health. Many patients begin with a variety of symptoms, which you can see here in this infographic. A variety of functional challenges, and what they're looking for is clarity on what they need to do to get healthy again. At GrassRoots, we use our exclusive timeline map and our history-taking process to draw out exactly why the illness has occurred. We use our crisis matrix to understand not only the underlying cause of the pain, but also the fastest route back to a healthy and happy, well-functioning body. Through our adaptation program, we isolate the right starting point so that in every step of the process, you're progressing towards a better state of wellness, emotionally, physically, and spiritually. Once we understand where we need to begin, then we take patients through our 3 phases of rebuilding their health: stabilize, accelerate, and finally elevate. In the stabilize portion of our program, we help people feel better, move better, think better, sleep better, those foundational elements that really matter. But most importantly, we're focusing on getting the body back into a natural cycle of healing. Our first goal is to decrease inflammation so that the body can rest, it can heal, it can come back into that state of balance. And at that time, what we're going to do after getting control over those symptoms, we'll put people on our acceleration track where they can become stronger, think clearer, and have a better level of overall function. We focus on optimizing gut health, restoring physiology and function, and developing habits that will promote long-term change in a continued state of wellness. Elevate is the final stage of the program. This is where we focus in on optimizing health and lifestyle so that the benefits are seen for the years to come. This is where we work towards restoring the health adaptation response. The adaptation response is the ability to come into contact with stress without completely breaking down. And that could be physical stress, chemical stress, or emotional stress. How one adapts to stress and the environment is the key to sustained health and happiness. And our Elevate process focuses on making the body function well, regardless of what life throws at you or your child. As you can see in this infographic here, this is just laying out the program. We have a couple of different programs. Depending on what's going on, it will require a different amount of time. This is just our foundational adaptation program. It's a 6-month program, and it involves both myself as the lead practitioner, a nutritionist who is trained and well experienced with functional medicine, and a health coach as well. So it lays out the appointments. Of course, every case is going to be a little bit different, but this is just gives you a good understanding of what's involved with the process. So I wanted to just end with a case study. So this is actually a child that I didn't see. I've only seen for a few months now, but I just got off the phone with him yesterday, or with his parents, and I thought it would be good to include it in this presentation. So we call him Michael. Michael's 11 years old, and his parents contacted me because he was having irritability, rapid mood swings, severe OCD, motor tics and muscle spasms, muscle aches that were migratory, and that is important to understand, and then sensitivities to sound and touch, and a whole host of digestive symptoms. We have all of our patients, when they come into the clinic, fill out a medical symptoms questionnaire where they total up the severity of symptoms for different body systems in there, and then we can get an understanding of where they're at or how toxic they are. So with Michael, his symptoms were at a 55. So you can see here, this is just an example of the medical symptom questionnaire where you rate your symptoms 0 to 4 so we can get a good understanding of where everybody is at and how they're improving to make sure we are addressing anything that is not improving and we're tweaking things appropriately. So Michael's history, he was actually a perfectly healthy child up until age 5, developed just like he was supposed to, no issues, no health problems. What happened is at the summer of 2013, he actually went on a trip with his family to Ohio and Pennsylvania. And at the end of that summer trip, he just had an acute onset of irritability. He kept feeling like his neck was really hot and overheated, which makes sense when we look at what parts of the brain this autoimmune encephalitis will affect. And he had stomach aches, he had intrusive thoughts, and this was just completely out of the norm for Michael. And then when we did our comprehensive timeline history, we found out that he actually got bit by a tick that summer, and that could have been a part of the reason that one of the reasons he developed some of these symptoms, which we'll look at in a little bit. But that's why it's important, again, to dive back and really focus on the time around when things change so you can figure out what steps you need to take next to get to the root of what's going on. 2014, his rage just skyrocketed. It started with headaches and this peculiar rash that just came out of nowhere and was not responding to any specific treatment. 2015, explosive involuntary movements, horrible sensations in his groin, excessive cleansing, more of this OCD type of behaviors. He had eczema that popped up, food allergies that popped up, loss of bladder control. So you can see his immune system was starting to become very dysfunctional, was starting to crash. They actually took him to a neurologist because his parents were absolutely phenomenal. And like most parents of the kids I see, they knew something was wrong and they weren't willing to accept that this was just how their child was going to be. So they took him to their PCP, they took him to their neurologist, and the parents actually looked into PANS and PANDAS. They read about this, they did their own research and went to the neurologist and asked them about PANS, and the neurologist just told them that PANS doesn't exist. They diagnosed him with Tourette's and they started him on an antidepressant, which didn't have much of an effect at all. 2016, symptoms became more pronounced. He went to the psychiatrist now and started other antidepressants. And then in the summer, he started with self-harming behaviors. And that's where it got really scary for the parents. Neurologist at that point said, you know what, there's not anything that I can do to help you guys anymore, which was, I can't even imagine how devastating that was for the parents. But they kept going, they kept searching out some answers. They tried some other drugs. Again, just this game of, try something, it doesn't work, let's try something else, it doesn't work, let's try something else, it doesn't work, which is pretty typical when we don't know what's going on, just kind of the shotgun approach with different pharmaceuticals. And then in November, he actually had to be admitted to a psychiatric hospital at 9 years old. The parents had to admit him to a psychiatric day hospital, which was just devastating for them. But they had no other options. They didn't know what to do. 2017, again, continuing the path to try to figure out what's going on, MRIs, CTs, colonoscopy, endoscopy, he had a lot of digestive issues. Even tried some dietary modifications, which did seem to help a little bit, but again, it was a waxing and waning of symptoms, antipsychotics, and then continued bladder control issues at 10 years of age. It's important to understand family history. So part of our intake and part of our history is really looking at what the family history is. And when you look at Michael's family history, mom's got thyroid, grandmother's got thyroid, the paternal grandmother has some thyroid, dad's got irritable bowel and eczema. So when we look at this family history of thyroid disease, it makes me think about autoimmune thyroid right away. A lot of times we'll see autoimmunity run in families, specifically with women, but we're also seeing dad with some eczema, which tells me about immune dysfunction. So right now we know just in this family history that Michael's going to have an increased risk of having problems with his immune system. So it kind of makes sense with what we're seeing in his clinical presentation. So what do we do with Michael? So the plan started out with some conventional and functional testing. We did a strep swab, oral and anal. We did a comprehensive stool analysis, a big nutrition profile, which is very, very helpful. It kills me how more people aren't doing these comprehensive nutrition profiles because the body needs fuel to function. The immune system needs fuel to function. You need fuel to detoxify. So if we're not feeding the body with the appropriate amount of macronutrients and micronutrients, then we're not going to be seeing long-term results that we're looking for. We also did a food sensitivity panel. We did in a comprehensive Lyme disease test through IGeneX, looking at Lyme and co-infections because we knew that tick bite had happened back in that summer where his symptoms started. Also started him on dairy-free, sugar-free, gluten-free, dye-free diet, and then pushed stress management, physical activity, all of those and sleep as well, because those foundational elements are just crucial to healing. So what do we find? On the initial testing, we found he actually was gluten and dairy intolerant or sensitive. He had an immune response to gluten and dairy. So we cut that out, but added in some of the other foods that we got rid of. And then we found that his immune system was suppressed. He had low immunoglobulin levels and low secretory IgA. Secretory IgA tells us a little bit about mucosal function in the gut. Remember that 80% of your immune system is in your digestive tract. So if your gut is not healthy, your immune system will not be healthy. So we saw low secretory IgA, which tells us his flora was not where it needed to be. These are the frontline soldiers that are going out patrolling for problems. When there's an abnormality in the gut, they will attack it. When there's been problems long term, then these levels will be low, showing us that the immune system is suppressed. He was also malnourished. Despite eating plenty of food, because of his gut issues, he was malnourished. He had lots of vitamin deficiencies, and he had severe amino acid deficiencies as well. So amino acids are foundational building blocks for all sorts of processes in the body: neurotransmitters, immune function, detoxification, muscle production. So when we're looking at neurotransmitters, he is getting on a bunch of drugs to recycle the neurotransmitters that are already there. But when he doesn't have those foundational building blocks to make neurotransmitters, those drugs are not going to be very effective. And that's what we saw in Michael's scenario and in his history. His Lyme test was not black and white. Very rarely are they, but it did show some Lyme-specific bands, so we know he had some exposure. He also had exposure to Epstein-Barr, and he had an active mycoplasma infection. Mycoplasma is a bacteria that is known to be a trigger of PANDAS. And so this is what we started with, and then what we moved to how we treated him. Again, gluten-free, dairy-free diet. We started supplements to correct his deficiencies. We emphasized the foods that are high in the nutrients he is low in, because my goal is not to have people on a million different pills forever. I want them to be focusing on the foods that are high in the nutrients they are deficient in. Now, this is very hard in today's day and age, because a lot of our foods are deplete of the minerals and the nutrients that our bodies need, but we definitely want to at least attempt to get what we can from our food. We put them on actually a customized amino acid blend. So with the tests that we do, it gives us specific recommendations based on his weight and his age and his levels. So we were able to send that in and get him started on a customized amino acid blend. We also started him on detoxification support, probiotics, and then a 21-day trial of azithromycin. Now, azithromycin is an antibiotic. The reason we decided to go down this path is because of the severity of his case, what he had been on already with the antidepressants and antipsychotics, and the lack of improvements that he's seen. And instead, we decided we wanted to be aggressive about this in the beginning, as opposed to going down the natural herbal route, which is something that we will eventually go to in the future, but right now we're seeing some pretty good results of this. So started on 21 days of azithromycin, which has coverage for both mycoplasma and Lyme disease. So what do we see on the follow-up? I talked to the parents, and the first thing that they said was, we have seen a lot of improvement over the last 4 weeks. OCD and tics dissipated significantly. That tingling and burning sensation in his groin was nearly gone. The rage episodes are significantly better, and his medical symptom questionnaire score went from a total of 55 to 17 in a matter of a month. So that is very significant. After this kid has been battling these problems for years now, and now we're seeing such a dramatic improvement in just a month's time, because we're finally on the right path here. Now, by no means is Michael out of the woods. He has a long ways to go, just like most people with PANS and PANDAS. It is a journey. It is not, and it is a marathon. It is not a sprint. So it's going to take time to get him back to where he needs to be. But these are some pretty significant changes. And, out of all of the therapies and all of the things that he has been through, this is the first time they're really seeing these dramatic improvements. So we're just extremely excited. The family is extremely excited. Michael's extremely excited. And we're just anxious to see what the next several months are going to show us. So it's important to understand that, PANS and PANDAS, again, it's a team approach. It's not, you need to have everybody on the same page. Again, parents and special educators need to be on the same page. You got to have a medical provider who is understanding of what is going on and willing to dive deep into the process. Again, it's good to update the school nurse and the school counselors. Sometimes you need a behavioral interventionist, OT, PT, cognitive behavioral therapy can go a long ways with these kiddos. And then specialists, like reading specialists, math interventionists, sometimes we need to adjust how these kids are learning to make sure that they don't take steps backwards with their academics. So you really want to just expand and educate all of the individuals who are going to be involved in their lives, and help them understand that the child is going to need some a little bit of an alternative approach compared to some of the other kids in the school. So the primary purpose of this talk is really just to expand the community's understanding of PANS and PANDAS. This is a big problem. We're seeing more and more of it, unfortunately. And again, it's getting overlooked and misdiagnosed by a lot of the medical community. So if you have a child who is presenting with symptoms that make you think that PANS may be part of the equation, or if you know someone who does, feel free to share this video. And even if you have another health concern, whether that's autoimmunity or digestive or just inflammatory processes in general, we would love to partner with you. Again, my name is Dr. Seth Osgood. We have a practice in West Lebanon, New Hampshire. We also have a clinic in Austin, Texas. We're accepting new patients. And if you really want to know more about us, or if you want to run your case by me and see if you would be a good fit, feel free to mention this video. We'll set up a free 15-minute phone call just to make sure that we would be able to help you. We're looking for a certain type of patient. We're looking for people who are motivated, dedicated, willing to do what it takes to get to the bottom of their health issues, because our biggest priority is your results. We want to see you succeed, and it needs to be a partnership between both the practice and yourself to get those results. So again, Dr. Osgood with GrassRoots Functional Medicine. Visit us online, www.grassrootsfunctionalmedicine.com. You can also give us a call, 888-644-7668, and we'll answer any questions that you have. I hope you guys have a blessed day.